Welcome back to our live coverage. One of the large topics of conversation here at the Mackinac Policy Conference is the crisis in Flint, which is still ongoing. There are people in the city of Flint who are still not drinking out of their taps, or if they are, they're drinking it out of filters. It is a crisis that has captured not only our attention here in Michigan, but attention across the country. And joining me now to talk about it is Dr. Mona Hanna-Attisha. You know her as the person who basically sounded the alarm on the lead levels in children in the city of Flint. And also joining us is Jeff Dwyer. He's the director of Michigan State University Extension Program. Thanks so much for joining us, both of you. I appreciate it.
Thank you very much.
You know, Flint is not far from our minds, and this has been an ongoing crisis that continues to play out. It's very easy for people who do not live in the city of Flint to go about their daily business, but realizing that people are still every day using bottled water and living their lives in such a difficult position. Dr. Mona, you have really been the face of what has been happening in Flint and still continuing to get out that message that people need help. Talk to me a little bit about how you assess the situation and how you see things in Flint right now.
Yeah, so like you said, Christy, we are in our third year of water that we cannot drink. In April of 2014, this started, and this April started our third year where our people, our children, cannot drink the water. So it's unprecedented to be in the middle of the Great Lakes and to not have access to safe drinking water. And unlike any other disaster or natural disaster that has struck our state or our nation, this is something that we may have to deal with for decades and really generations to come. And we have yet to garner the long-term resources for our kids or for our community to heal. So the water is still a problem, and we keep talking about Flint. I keep talking about Flint because we have yet to invest in Flint so that we can recover, and not only recover, but thrive because of this incident.
You sound frustrated. Are you frustrated that the legislature has not come through yet with the funding?
Yeah, I'm frustrated. So the governor has a great budget that he's proposed, and it has yet to pass the state legislature. Congress in DC has given $0 to Flint. Despite all this talk about Flint, it's a national story. Limited resources have come to Flint, and limited resources have come when you understand the extent of this long-term problem.
What has this past 10 months been like for you?
Yeah,
how has it changed your life?
It's significantly changed my life, but in a great way. I feel fortunate to be able to serve my community, to be able to serve my patients. It's been exhausting, but it's been exhilarating. You know, the same urgency that we had when we were doing this research, because we had to know what was happening to our kids, is the same urgency that we have right now, because if we don't keep talking about Flint, you know, they're going to start talking about Zika and some other thing in the state or what have you. So we need to garner the resources for our children.
All right, so talk to me a little bit now, Jeff, about how you're working with the community and making sure that people understand that the resources that they have and to be able to help them.
Right, so I think what's important to know is Extension, we have 600 people throughout the state of Michigan. Before this ever started, we had 15 people in Flint and Genesee County. So we were there, we have a history there, we have our folks live and work there, and so we've had the great opportunity to work with Dr. Mona and other healthcare providers on health-related issues like what to eat and how to prepare it and where to get it and that sort of thing. We were able to take a class we call Cooking Matters and rotate that content a little bit to include items high in vitamin C, iron, and calcium to deal with the lead absorption issues that youth and kids in Flint were dealing with. But Extension's also been able to do some other things. So there are concerns, for example, about lead in the soils. And so we're working with MDARD and others to do soil testing in Flint. Edible Flint is a big part of what Extension does in Flint. We work with over 800 community gardeners in Flint alone, and to help them grow nutritious foods. We also work with families and parents around stress issues and mindfulness and personal finance issues. And so we're involved in health, and we're lucky to work with Dr. Mona in that context. But we also try and look at the whole person and the whole family, because if a mother is worried about paying the rent and where she's going to get the groceries, it's sometimes hard to focus on some of these other issues that we'd like her to focus on as well.
Dr. Mona, what are some of your patients telling you, and kids and their parents? What are they telling you now?
So what we're seeing right now and what they're telling us is a lot of stress. They're worried. You see fear in their eyes. They're anxious. They feel guilty. So that's the acute thing that we are seeing and hearing from our patients. And what we do best as pediatricians is a lot lot of reassurance, is a lot of hope building. So we're trying to build a lot of hope in our families and empower our families. Say, hey, you're going to be okay, and this is what you need to do. Love your child and sing to them and read to them and talk to them and turn off the TV and put them in preschool and give them this great nutrition and come visit me at every visit, and we'll make sure your kid's okay.
But I would think that there would be a problem with trust as well.
Absolutely.
That people don't maybe exactly trust what they're hearing from programs. And they think, well, maybe this could be good, but you know what? I trusted that when I turned the tap on that my water was fine, when it was repeatedly told to me that it was fine. Right. How do you repair that, and how do you play a role in trying to repair that?
So building of trust takes time. It takes decades. And the neat thing about MSU and about Hurley, where I'm at, is that we've been in the community for over a century. MSU Extension has been in Flint for over a century, as has Hurley. So we are trusted partners. But it is going to take time to continue working on that trust and that rapport building and sitting down with those families and listening to their concerns and being as empathetic as possible and understanding their frustrations, because they have been through so much. This has been a trauma. The entire community, you can think about, is going through PTSD. So it takes it's going to be a long road to heal and to recover, but just being there, being constantly visible, and providing the necessary resources.
Being constantly visible and providing those resources, but also making sure that you're getting to people that know that they have that available to them. I mean, you already have people that are engaged with you. It's also reaching people that maybe haven't even been to a pediatrician in years with their children.
Right.
Absolutely.
And you're exactly right, and I think that's one of the exciting things that's happening in Flint. Is a lot of what you see Dr. Mona and others doing is built on a foundation that was already being put in place. So the pediatric clinic moved above the farmer's market a year ago. It's a beautiful setting, right? It's an opportunity to prescribe to families and to children, go downstairs and get fresh vegetables.
We're the only clinic in the country that's co-located in a farmer's market to address food insecurity. There are no grocery stores in Flint. So we give prescriptions for healthy food, and they go downstairs and then get the healthy food. So we were already trying to tackle these other issues that weren't making our kids healthy. And the lead came on top of that. But we already kind of had that foundation. And with all the resources coming in, we only see a brighter future for our kids, brighter than really their yesterday ever was before this crisis.
Your voice has been one that has cut through a lot of the clutter and that people listen to. So what would you say to the legislature right now in Lansing about what they need to do for Flint?
Yeah, I think it's, they need to put politics aside. This is not a political issue. This is not a partisan issue. This is not who did what when. And this is about children. This is a humanitarian issue. This is about turning on your tap and getting safe water. So we need to all come together, because Michigan cannot be strong until all of our cities are strong. And Michigan can't be strong until all of our children have the same opportunity to be strong. So we need to invest in our kids, the younger the better, because until Flint shines, the state is not going to shine.
All right, Jeff Dwyer from MSU Extension, thanks so much. It's good to see you. And Dr. Mona Hanna-Attisha, thank you so much for being here with us. We look forward to hearing you speak pretty soon here on the stage.